What's cracking, guys? Dr. Eric Smith here today. I have Laura with me, and if you guys have watched my videos, you've seen that I've adjusted Laura, but it's been a long time since I've seen you, right?
Yes, I'm not doing very well.
She's not doing very
well.
Not
doing well without you.
So I thought we would have her back on because I'm going to do a few more things, and now that I'm at Redcon, I wanted to show you how we do some of the treatments here. So some of the biggest things you said, like what's bothering you the most right now?
It's definitely my neck. It's been missing some adjustments. As you know, we usually do maintenance with that.
Yep.
And then I haven't been very active because I was sick for like about a month.
Okay.
And so my lower back is messing with my like sciatic area. So this side has been messing up with me.
Okay. So a lot of you have that kind of problem where you start to feel it and it's starting to travel down. Now it's not going past your knee though, right?
No, it's definitely like just here to here.
Okay.
And sometimes the bend of the knee, I feel it sometimes.
Feel it back there too.
Mm-hmm.
So we'll check her out and then we'll get into a few of the therapies we have. But for those of you that have not liked and subscribed for my channel, make sure you do that below so that way we can make sure. And I'll also put, because Laura is very artistic.
Yeah.
So she does a lot of cool things. She's going to maybe create some content soon. So we'll link her too so you can follow her journey on her things that she creates. And if you guys need her help, you can contact her, as well as if you are going to be joining Redcon, we got some cool promos coming out for the new year. So want to make sure that you take a look at those. So let's do a few things first. If you will, go ahead and have a seat here and facing that way. So I can just kind of get behind and take a look at some of the bigger things with you. So Laura is pretty flexible. So she has a large range of motion, but man, have you been sleeping on your stomach lately?
No.
No.
No, I've stopped doing that.
You knew where I was going to go with that.
But it's definitely there. The way I'm sleeping is the messed up part for sure. I've been waking up with a shoulder pain that I can't explain.
Okay. Left, right? Which shoulder? What's going
on? It's like this one. Maybe both of them. I don't know. I just wake up and I'm like, oh, what was I doing in my sleep?
So you can feel that.
Yeah.
Well, your traps are pretty tight through here. And then so a lot of times people get this pain right here and they always say like, oh, it's because I it's where I hold my stress. But this is the point called your alleviate or scap, and this muscle attaches on the side of your neck. So it either brings your head back in this way or it brings your shoulders up and over. And Laura, if we get her in position, we can get her shoulders back, but we also have to get her head, and that's where it gets a little like jammed up that doesn't want to come back. So for a lot of people that may seem like that's a normal range of motion, but for her, because I worked on her so much, she's pretty limited in there. And then does it hurt to lean back at all?
It feels tight, but no pain.
Okay, what about when I lean to the side?
Mm-mm.
Good. Go to the side here. Okay. And lean forward for me as far as you can. Feel any like tightness through here?
No.
No. Gotcha.
This is my comfort zone.
Yeah, so back through here, this is where you feel the best is when you lean forward, right?
Yeah.
Okay, so you can go ahead and sit back up. So what I like to do when I adjust is I typically, if a patient feels better in a certain position, that's how I like to adjust. Because if you lean forward, it feels better, but it feels worse when you lean back, right?
Yeah, it feels more pressure.
So we don't want to adjust her index extension. A lot of times people have too much pressure back through here, and when they lean back, the body's telling you something. So if I had to guess and she's having pain through here, probably with maybe sitting, traveling, and doing some things that her hip flexors in the front are really tight, which is causing this to be jammed up. So even though we could chase the pain back here, probably her hip flexors are tight. And we'll do a test to see on her if that's positive. So go ahead and lay on your back first for me, please.
Okay.
So normally the test that we would do to see if somebody's hip flexor's tight, and with her, it's hard to see if she's positive because she's so flexible through her hips. But you could do this at home, and if your leg comes up like this while I do that, then your hip flexor here is too tight. But with her, I've just always known she's pretty flexible. So even though the test isn't positive, doesn't mean that her hip flexors aren't too tight. So have you been having some pain more in the front there?
No, not really. Okay. I definitely have been stretching, keeping my tradition going, but I feel it when you pull it up a little bit tight, a little bit maybe, yeah.
Yeah. Okay. And sometimes when people sleep, when they sleep on their side, they'll sleep with kind of like a leg up. So that'll add to it a little bit more too. Have you been doing any cardio or any type of running or anything?
No, just walking.
So
I haven't been very active at all. In Dominican Republic, I don't have a gym, and yeah, so just me, myself, and my walks.
With Charlie, right?
Yeah, well, not Charlie over there.
Oh, not Charlie over there, yeah. He didn't get his passport to go with you, right?
He's been pretty depressed without me.
Go ahead and roll over to your stomach for me, please.
Okay.
And we'll have you put your face in there, arms down to the side. So we'll use a cold laser on your SI joint. And if those of you who have seen the video I did with Skylar, A lot of people like that one, where what a cold laser does is kind of just drive out inflammation. So we have our spine, and then right through here is your sacroiliac joint. So your sacroiliac joint is two main joints through here, one here, one here. And what they do is your entire spine wedges into your sacroiliac joint, creating your sacrum. So when that gets jammed up in there, and a lot of people will see either have like a little dimple, or they'll have this kind of like inflammation or pain through there. That's normally where you're going to get a lot more of the pain. So as you can see, a cold laser itself, like you don't ever want to look at the laser itself, but what it does is it puts light energy into the cells to decrease inflammation and kind of get the healing process going. I like to do this before we get into the adjustment, because as we do adjust through there, then it'll increase the blood flow. And what we do want to do is use this in an area that has decreased blood flow. So it'll increase the energy going into the local cells to decrease the inflammation. So can you use a cold laser after? Absolutely. Will it still be effective? Yes. Will it be more effective if you do it before? Yes. So lots of questions about that when people saw the video. And we just kind of cycle through the main areas of our sacroiliac joint to kind of drive some of that out. So yeah, and you're right-handed, correct?
Yeah.
Yeah. So usually the side of dominance is where people will be a little bit more tight. There's a little test that we'll do here in a second to, since it seems how you pass the other test, to see what's going on. So you're going to do some traveling. Obviously, you've been staying fit, though. You had a wedding you had to be in, right?
Oh, yeah. My arms were looking great.
Very good.
All the pictures came out good.
All the hard work was done. Then you got a little bit of a break, right? So another test that you can do to see if the hip flexor's tight is, this is mainly for your quads. Clearly, she can get there. But if I blend the two, feel anything in the front?
No, I feel the pressure a little bit in the back. Yeah.
Okay. And then same kind of thing here. So this side, so very loose through her quads. But when I do this, feel anything in the front?
It just feels tight. Okay. No, not really pain. But...
Good. Let's take a look and see what we got going on with her heels. So a little bit, not too far off. She's normally been pretty good with that. Let's get into your adjustment then. Do some stuff through your thoracics here. Nice deep breath. And all the way out. Good work.
All right, back at you.
And so I remember from her adjustment, she doesn't really respond very well to the one that I do face down. So we're going to do it a little bit differently through this area with her, but I'll have her lay on her right side and face me. See, I remembered this time.
I'm a regular.
She's a regular. Good. Keep her leg nice up like that. So as I talked about, I don't want to adjust her in extension because that bothers her. So what I'm going to do is have her drop her leg off. Bring this back. Nice deep breath. Let it all the way out. Good. Let's go to the other side. How'd that feel?
Feels great.
Good.
Mm-hmm.
There you go. You didn't fight me on that one.
I'm trying to be better.
And scoot up a little bit more for me, please. So you're getting some tension underneath your neck too?
Yeah.
A little bit in there.
Mm-hmm.
Yep. The face says it all. So we'll get that adjusted. That works. Good. Good job.
I already know the trick.
She already knows the trick. She's not falling for him. Yep, exactly. You got it. Good. Okay. And then, so when you said you were having the shoulder pain, were you having it more like in the front?
It's
deeper in the shoulder?
It feels like on the top part. It feels like maybe I was like laying on my shoulder a little bit, but when I wake up, I'm not in any weird position, so I don't know what I was doing in the middle of the night.
Okay. Just a little traction here. So you're pretty flexible, so we don't have to do too much of a big adjustment, but just try to loosen it up a little bit. If I would say it's anything, it's probably because you're so used to working out,
Yeah.
and now you're not working out as much, your shoulders are getting a little bit tighter.
Yeah, for sure.
It's so funny because you're so flexible that it doesn't really, like, again, like most normal people, you wouldn't see that range of motion, but with her, she is. So scoot down the table just a little bit more so we can get your thoracics.
Yeah, I am hypermobile, so.
She is. Tuck your chin to your chest, nice deep breath. Let it all the way out. One more. Awesome. Let's take a look at the these wrists. Any problems with the wrist while you were traveling?
No, but my wrists always feel pain just from the hypermobility thing.
Mm-hmm.
All my joints are messed up. You'd think that it would be better, but no.
It's a good point. So I'm glad you mentioned that, because a lot of times people ask me like, hey, is it okay to get adjusted if I'm hypermobile? It is, but it also means you probably don't need adjusted or as hard all the time. Doesn't mean that you won't have joints that don't need to be moved in the right fashion, but it also means that you could use adjustments. So ankles and such. Any problems with these when you're on the beach?
No.
Dancing, anything like that? Let this relax. Good. Needed that, I guess.
No problems, but
No.
we're preventing them.
Good. Yeah, those move just fine. Very cool. Let's have you swing your legs around that way. We'll do a couple shoulder adjustments.
Okay, let me pick all this thing.
All that hair. Cool. This guy. A little bit there. Not too bad. Drop this elbow for me. Good. A little hug. Good.
I felt the shift.
Felt the shift. Sometimes you won't get the pops and cracks. Good. Awesome. Definitely could use some muscle work up here, but try to move your head a nice big circle. How'd that feel?
It feels better, but yeah, I definitely feel a tightness on this side.
So we're gonna do some more muscle work and try to just stretch out that levator scap with some just random stretching, and not random, but specific stretching that we kind of do for this. So those of you that have that type of pain, definitely get in, get the bones adjusted, work on the muscle. It all connects together. And Laura, thanks for coming in today. I know we'll be seeing you again soon. Thanks for tuning in, and we'll see you in the next video, okay?